Have you ever woken up in the middle of the night with a burning pain in your big toe, ankle, or knee? That could be a gout flare, and surprisingly, your sleeping position might be making it worse. Gout doesn't just hurt, it also disrupts your sleep. For seniors, a poor night's rest can lead to fatigue and even trigger more frequent gout attacks. That's why today's video will guide you through why gout pain gets worse at night, and more importantly, how to sleep in a way that relieves pressure on your joints. We'll cover sleep positions, pillow support, and pre-bed habits that really work. You don't have to suffer through sleepless, painful nights. A few simple changes can lead to better sleep and better mornings. Gout is a metabolic disorder where excess uric acid in the bloodstream crystallizes and settles in the joints, most commonly the big toe, ankles, or knees. These uric acid crystals trigger inflammation, swelling, and intense pain, sometimes so severe that even the lightest touch becomes unbearable. But why is the pain often worse at night? There are a few key reasons. First, body temperature naturally drops slightly during sleep. This cooling effect can promote uric acid crystallization, which irritates the joint tissue. Second, as you sleep, your circulation slows down. This makes it easier for uric acid to pool in the lower extremities, like your feet and ankles. Poor sleep posture can make things worse. If your foot is pinned under a heavy blanket or not elevated properly, it may restrict blood flow further, increasing inflammation. Some people curl up with their legs bent tightly, which puts pressure on the joints for hours, intensifying pain by morning. Other nighttime factors, such as mild dehydration, alcohol intake, or late-night meals high in purines, may also trigger gout attacks, right when your body needs rest most. Understanding these mechanisms is the first step to choosing the right sleep position, pillow support, and bedtime habits, so you can rest better and reduce the chance of nighttime flare-ups. When a gout flare strikes, even the slightest movement can disrupt your sleep. That's why choosing the right sleeping position is essential, not just for comfort, but for joint recovery overnight. There are 3 key goals. 1. Reduce pressure on the affected joint. 2. Improve blood flow. And 3. Keep the joint in a neutral, relaxed position. 1. Back sleeping with elevated legs. This is one of the safest and most recommended positions for people with gout in the feet. By lying on your back and placing a pillow under your calves or ankles, your feet are slightly raised. This enhances circulation and helps prevent uric acid buildup in the joints. It also prevents body weight from pressing down on the inflamed area. Use a soft, thin pillow or a bolster placed just below the calves. Make sure it distributes support evenly without causing numbness. If you sleep with a blanket, ensure it doesn't rest directly on the inflamed foot. A blanket lifter can help keep pressure off the feet. 2. Side sleeping, painful side up. If you prefer sleeping on your side, lie on the opposite side of the pain. For example, if your right big toe is inflamed, sleep on your left side. Place a pillow between your knees to keep your hips, knees, and ankles aligned. Choose a thick enough pillow to keep your legs from rubbing against each other. Memory foam or firm polyester pillows offer good support and softness throughout the night. 3. Small pillow under inflamed toe or foot. For pain in the toes or forefoot, place a small pillow or rolled towel under that area. This lifts the joint off the bed, reducing friction and swelling. 4. Avoid curling or tucking limbs tightly. Some people sleep with their legs tucked under their body or knees curled into their chest. This restricts blood flow and increases joint pressure. Instead, keep your legs gently extended with pillows supporting them. 5. Choose the right blanket and mattress. Heavy blankets press directly on painful joints. If you don't have a blanket lifter, place a pillow horizontally under the blanket to create space above your feet. Avoid overly soft mattresses, which cause your body to sink and misalign your joints. Real-life tip. Mr. Long, 68, reported that switching from a curled-up side-sleeping position to lying on his back with elevated legs drastically reduced his nighttime pain. He now sleeps 6 hours straight with a small pillow under his inflamed toe. When dealing with gout, choosing the right pillow and mattress isn't just about comfort. It's essential for pain management during sleep. These items should reduce joint pressure, promote circulation, and maintain the body's natural alignment. 1. Leg elevation pillow. Support without compression. A leg support pillow helps elevate the inflamed area, reducing swelling and pooling of blood in the joints. Choose one that's firm enough not to collapse under weight, but soft enough to prevent numbness. Wedge pillows or memory foam leg pillows work well. 2. Pillow between the knees for side sleeping. If you sleep on your side, placing a pillow between your knees keeps your hips, knees, and ankles aligned. This prevents the top leg from pressing down on the lower joints, reducing pain from compression or rubbing. 3. Toe or forefoot lift pillow. For those with gout in the big toe, a common spot, use a small pillow or rolled towel to keep the toe from pressing against the mattress. Lifting it slightly helps avoid friction and reduces overnight throbbing. 4. Mattress choice. People with gout should use a medium firm mattress that distributes weight evenly without applying pressure to specific joints. Memory foam mattresses provide body contouring with good support. Too soft mattresses lead to sinking and misalignment, while too firm mattresses cause discomfort at contact points like shoulders, hips, and heels. 5. Breathability matters. Choose breathable materials for both pillow and mattress to avoid heat buildup around inflamed joints. Cotton, latex, or ventilated foam are excellent choices. Not just sleep posture and bedding. Simple nighttime habits can significantly reduce gout flare-ups and help you sleep with less pain. Here are some practical tips. 1. Light dinner. Avoid high purine foods. A heavy dinner rich in purines can trigger nighttime gout pain. Avoid seafood, red meat, organ meats, beer, and red wine at night. Choose a light dinner with leafy greens, whole grains, berries, and lots of water. 2. Stay hydrated throughout the day. Dehydration worsens uric acid buildup overnight. Drink water consistently during the day and have a small glass before bed, just enough to stay hydrated without interrupting sleep with bathroom trips. 3. Warm compress before bed. Apply a warm, not hot, compress to the affected joint for 10 to 15 minutes before sleeping. It improves circulation, relaxes muscles, and soothes pain. 4. Cool, calm sleeping environment. Keep your bedroom around 20 to 22 degrees Celsius. A stuffy, warm room can increase inflammation and discomfort. Use a fan, light air conditioning, or open windows to maintain airflow. 5. Reduce stress before bed. Stress raises cortisol levels, which can intensify pain. Wind down with calming music, light reading, or mindfulness meditation before bed. 6. Slight leg elevation. If the pain is in the toes or ankles, elevate your legs slightly with a soft pillow to reduce swelling. Avoid raising them too high to prevent joint misalignment. 7. Stick to a sleep schedule. Consistent sleep helps the body heal and regulate inflammation. Aim to sleep by 11 p.m. and wake up at the same time each day to support immune balance and pain management. Gout pain doesn't just steal your sleep. It affects your overall well-being and quality of life. But you're not alone. With small adjustments in how you sleep, the right pillow and mattress, and healthier bedtime habits, you can ease nighttime flare-ups and finally enjoy deeper rest. If you found this video helpful, please like, share it with someone you care about who also lives with gout, and subscribe to Restful Years for more senior-friendly sleep and health tips. Remember, sleeping right isn't just lying down, it's giving your body a chance to heal. And we're here to support you every step of the way.